Scott.
Just, COPD is a very, as you well know, very episodic disease with exacerbations, and how are you going to take the variability into, or what's your plan to take that into account?
Yeah. That's an excellent question. It's a question on the content that is really an important one. First of all, not all patients with COPD do have these exacerbations. There is a subgroup of patients who have these repeated exacerbations. As I showed you, but probably went a bit too quick, we will develop two tools. A first tool will be a tool for daily use. So the patient will start a study and will start to fill out the items and wear the activity monitor, and we'll follow this patient over time, and we'll see when acute exacerbations occur. We actually think that looking at physical activity will be a very good way to detect acute exacerbations that may otherwise have passed unnoticed. Of course, we will not only look at a daily basis. Some studies may just merit something that is on clinical visits, for instance, every 3 months, and then, of course, you cannot measure during this acute exacerbation. But we feel that we can do three things, actually. First, a continuous measurement in a group of patients that's likely to develop these exacerbations, and so they will develop another exacerbation. The recovery from acute exacerbations is crucial, but then you need a more severe exacerbation that's picked up, or a patient who has been hospitalized, or you can just use other tools to go about exacerbations and just look at physical activity over time and take into account the number of exacerbations that have been in between, because we know that the reduction in physical activity levels is actually tightly linked with the number of acute exacerbations that have occurred as events in between.
Okay, any other questions? I have one
in the back.
Oh, okay.
From the patient-reported outcome research, it's well known that physical activity tends to be not so good related to the patient-reported outcomes. Mm-hmm. How do you deal with that? Or how do you think to deal with that?
What do you mean exactly?
You want to have one measure for the patient-reported outcomes, but you incorporate physical activity.
Mm-hmm. Yeah, so we see this outcome measure as a multidimensional measure where you have and we don't know what exact dimensions we will end up with because we're doing the qualitative research right now, but the amount of physical activity will definitely be one component that patients feel is important, and an improvement thereof is something that they consider of high value to them. Rather than to ask them what they've done in a day, we will measure this. So that's one dimension of this patient-reported outcome tool. Another dimension may be the symptoms. How many symptoms do I experience when I'm physically active? So that will be a second dimension, and we'll end up with one sum score, but then several subdomains of this patient-reported outcome tool. Much like a quality of life questionnaire where you may have several domains, we will look at this in domains and also in a sum score.
Okay. Thank you.
Okay.
You had a question or not?
Yes, okay. I did. I happen to know that they're also working on patient-reported outcomes questionnaires in UBioPred, for example, at least if I'm not mistaken. How are you actually collaborating between the projects?
Yeah, of course, that's important to sort of look around and make sure that you have all expertise on board. One very concrete way that we use to deal with it is that Professor Peter Sterk, who is the project leader of the UBioPred project, sits in our advisory board. So we have a direct link between UBioPred and Proactive in that respect. So we will be sure that if there is something that emerges in UBioPred that is important to us, that will also keep that on board in our project. So that's one way of very formal collaboration. Now, on the other hand, I think that asthma is very different from COPD, and it would be very unwise, I think, to go to a regulator with a patient-reported outcome tool that is developed for asthma to try to get it accepted in COPD, because both in terms of how the disease develops, in how the disease behaves over time, in the age of the patients, there are very clear differences between these two diseases, and a regulator would probably not accept a PRO developed in asthma to be used in patients with COPD. Nevertheless, if there are tools that sort of pop out in the UBioPred project, which may be relevant to us, we'll hear that immediately through Peter Sterk. And I think it's important, if there are several calls in let's say, disease areas, that there are formal links between these different projects, because we're basically all on the same page. Similarly, the FPM members are often the same people, so there is really a lot of cross collaboration between these two projects. Yes.